Good morning, everyone. Thank you so much for joining us this morning for Emory Healthcare's Health and Wellness monthly virtual series for DeKalb County School District employees. We are super excited to be back in 2024 with you all. We have a really exciting presentation this morning from one of our phenomenal family medicine physicians, Dr. Carmen Echols, who's able to so graciously join us. She practices at our Emory at Stonecrest Primary Care location. She attended Wayne State University School of Medicine in Detroit, Michigan, and then completed her residency at Medical College of Georgia. She is a wealth of knowledge, and we are so excited that she's able to join us this morning. And so I will pass it off to her to get us started.
All right, very good. Good morning, everybody. Give me a couple of shakes and I'm gonna share my screen. All right. So this morning's presentation, sort of obvious what we're talking about, and it is about diabetes, a condition that so many people in the United States have, whether it is type 1 or type 2. But as a family medicine physician, most commonly I see type 2 diabetes. So a lot of the information in this presentation is not going to totally admit type 1, but it is going to be geared more so toward type 2. So the goal of the presentation is to get a better understanding of both type 1 and 2 diabetes, learn about insulin resistance and its role in prediabetes and diabetes, be more informed about diabetes complications. I'm sure that so many of us have known someone to be on dialysis, lose their eyesight, or lose a limb due to diabetes, but to be more informed about that. And also too, how can we omit this? How can we avoid diabetes? That's pretty important too. And as a family medicine doctor, also, I love teaching about not just treatment, but prevention. Prevention is also very important. So, statistics, about 11% of the US population has diabetes, and these were basically statistics that came out just as COVID hit. About 13% of adults in the US have diabetes, and a whopping quarter of adults in the US had prediabetes in 2018. And I'm going to touch a little bit too on the difference between insulin resistance, prediabetes, and diabetes. So, type 1 it is most commonly known as autoimmune, if you will. The body cannot produce insulin, which is a blood sugar lowering hormone, is what it is. And ultimately, people who have type 1 diabetes, they require insulin to survive. And you can even see the lack of insulin in people if they have really, really bad pancreatitis, if they've had their pancreas removed, or even if they have a condition where the pancreas doesn't work at all. And that's often more so seen as type 3, but type 1 is autoimmune. The body sees the pancreas and the pancreatic cells as foreign, it kind of attacks itself. The cells don't produce insulin, and you develop type 1 diabetes. Type 2 is the one they're like, oh, diabetes can be prevented. It's due to insulin resistance. And I'll get into what exactly is insulin resistance in this presentation as well. It can be managed with lifestyle modification, controlling type 1. Lifestyle modification is important. Just because you're injecting insulin or because you have an insulin pump, it doesn't necessarily mean that you just go in and eat all the sweets or all the carbs you want, because then you'll need more insulin to lower your blood sugar. So again, that's not to take away from the fact that type 1 doesn't mean you can eat whatever, but type 2 can truly be managed with lifestyle modification. And you may need oral medicine and or insulin, depending on your body. Risk factors include age. Type 1 tends to be more so diagnosed in childhood. I've had probably a less than a handful of patients who I have diagnosed with late onset type 1 diabetes, and they were usually in their early 20s. Type 2 diabetes, typically you see them and see that in an adult, usually over age is 45. But of course, with the sedentary lifestyle that we have now, the screen time, the horrible, horrible screen time, which is so convenient for some of us, especially those of us who have children. And also, too, the increase in processed foods and the fact that they're putting sugar in everything, you're actually starting to see type 2 diabetes in younger age groups. Having a history of diabetes in a first generation relative increases your risk of developing either type 1 or type 2. And having pre-diabetes, if you're not careful, you can easily segue into type 2 diabetes. If you are a Black or brown person, African American, Native American, Latin American, Pacific Islander, also increases your risk of having type 2. Physical activity, I touched on. Certain medications, if you are on steroids for any reason, and in some cases, they're even showing that statin medication can raise your blood sugar and therefore increase the risk of type 2 diabetes. And definitely if you had gestational diabetes or gave birth to a baby at greater than 9 pounds. Non-alcoholic fatty liver disease and sleep disturbances. We often neglect our sleep and don't see the importance of sleep as it relates to good health. But if your sleep cycle is thrown off, it can raise your cortisol levels, which can increase your insulin resistance, which can increase your risk of type 2 diabetes. So you're probably sick of me talking about insulin resistance. You're like, well, what is this insulin resistance that Dr. Echols is talking about? And you'll see my guy here. I don't know if you can see my pointer or not, but I'll just move it around. He loves his carbs. He is stressed. He leaves work, goes to fast food joint for lunch every day because he just has to get out the office and he consumes a high carb diet. And it may not necessarily be burgers and fries and a Coke. It could be a big plate of pasta from Olive Garden with some breadsticks. And as a result, he winds up getting constant high glucose in his blood. And the pancreas says, oh my gosh, we need to do something to get this sugar down. Let me release insulin. Typically, the insulin will basically open up cells. The cells will use the sugar as energy. But after a while, the insulin receptors stop responding, and the insulin can't do its job. And as a result, the sugar in the blood remains high. The cells starve. The insulin level is still high because it's like, what are we doing here? We can't actually open up the channel so the cells can use the blood sugar. And then as a result, I mean, if the cells are starving, you're starving too. You can get other health problems, and then you go back to eating more carbs. Why? Because you're hungry. You need that energy, and your cells think it needs energy, but actually, all the energy source is in your blood. So that's how your blood sugars go up. So it's important to note, I think I may have this in an upcoming slide too, that it all starts with insulin resistance. By the time somebody's A1C, when they go to their doctor for their physical, whatever the case may be, and their A1C is elevated at 5.9, we'll talk about that too, they've been insulin resistant for years. And there's no way to know this unless you get a fasting insulin level drawn, which many physicians are hesitant to do because then the question is, will my insurance cover it? So I want to put that out there. So typical symptoms, fatigue, increased thirst, increased urination, numbness, tingling in your hands and feet, blurry vision, and you can get yeast infections. And a lot of my patients ask Dr. Echols where these yeast infections come from. I say if you've ever baked bread, what do you need to render yeast? You need heat, dampness, and sugar. So if you sweat a lot under your arms, groin area, anything like that, it gets moist, it gets warm, you are full of sugar at this point, then it allows yeast to grow. And it's also important to know that a lot of people who are diagnosed with diabetes don't have these symptoms at all starting off. It's just simply because their sugar is not high enough for them to have blatant symptoms like this. So how do we diagnose diabetes? You need 2 hemoglobin A1Cs over 6.5. And what is an A1C, you ask? Glad you asked. It is the 3-month average of your glucose readings, roughly 2.5 to 3 months. And as far as blood glucose goes, you need at least 2 readings of a fasting glucose over 126, or you can have 1 random glucose greater than 200. So those are the numbers we use to diagnose diabetes. Oh, and I wanted to make the point too, the difference between prediabetes and diabetes is just a number. You'll see diabetes, it's 5.7 to 6.4, and then once you reach that 6.5 threshold, you're into diabetes. Remember, you're insulin resistant long before that number goes to 5.7. So these are just some things that I like to point out and advocate for people to get their annual physicals too. You'll notice that many of these things, minus maybe the fundoscopic evaluation or the foot exam, these are tests that doctors will do at your annual visit, your annual physical, also known in Dr. Echols' world as your annual oil change. You want, like you take your car to go get an oil change and you get a multi-point inspection, you want to make sure you get your physical and not only come in when you think your alternator is failing, when the lights are flashing, your car is powering down. You need to see your doctor before then. Go for your oil change. So a lot of these things can be caught at an annual visit. And of course, there's certain things that we would actually target for a person with diabetes during the annual visit, making sure their feet look okay, making sure their pulses are okay, the eye specialist, making sure they see their ophthalmologist annually for a dilated eye exam. So treatment, again, lifestyle modification. Just because you have type 1 diabetes doesn't mean that you can go out eating any and everything and insulin. For type 2 diabetes, lifestyle modification, pills, the non-insulin injectables, the also popular GLP-1 agonist known as Mounjaro, Ozempic, um, Trulicity, and the pill which is Rybelsus. And there are all types of insulin that can be used as well for treatment. Complications. So the good, bad, and ugly. Your sugar can drop if you take too much insulin. You can get a condition called DKA, known as that's the short term diabetic ketoacidosis, and HHS. DKA we typically see in patients who have type 1. HHS we see in patients who have type 2. This is when the sugar can get extremely high, sometimes getting over 600 or over 1,000, and it potentially leads to a diabetic coma if not unchecked. Cardiovascular disease. We often think of diabetes as a condition of a touch of sugar versus looking at sugar as little bitty teeny tiny razor blades that just slowly nick blood vessels over a period of time. And those blood vessels include the blood vessels in our heart, the coronary arteries, the arteries that surround the heart, the blood vessels that are in our feet. The blood vessels, now this makes some of my male patients uncomfortable, but I mean, it is what it is. The blood vessels that allow blood flow to the penis. And as a result, sometimes people have erectile dysfunction because of that. Kidney disease, we know about that. Diabetic neuropathy, same thing. If the nerves don't communicate with the blood vessels can't necessarily carry blood to the areas that it needs to. Diabetic retinopathy, that is another example of a vascular condition as well. Not only are the blood vessels in the retina damaged, they also grow back in a distorted way, and that can lead to blindness. And I did mention sexual dysfunction, which, by the way, is not mutually exclusive to men. Women can get sexual dysfunction too as a result of diabetes. So how do we fix this? Annual monitoring for the development of diabetes. Cue my previous point about the annual oil change. You want to achieve and maintain a weight loss of about 5 to 7% of the starting weight in fat. And I often emphasize that because the key is fat loss. You don't want to lose muscle. I know a lot of people, they do fad diets with the anticipation of losing weight as opposed to focus, discipline, and having a jump start. But it's like, oh, I lost so much weight. But how much of that weight was actually fat? You want to make sure you lose fat and not muscle. That is very important. Moderate intensity physical activity to include cardio and strength training. I like to emphasize that, especially to my female patients, because they typically shy away from weight, saying that it makes them bulky. But actually, studies have shown that the combination of cardio and strength training allows those starving muscle cells to better use that excess blood sugar in your bloodstream as an energy source. And the CDC actually has lifestyle change programs, which, if you're pre-diabetic, you can actually enroll in them. Once you reach the threshold of diabetes, then you're looking at more so diabetic education. But I always tell my patients, for those of you who are pre-diabetic, please, please, please check out a CDC recognized lifestyle change program near you. And treating for modifiable cardiovascular risk factors. So obesity, smoking, excess alcohol use, those are things that can be modified. Unfortunately, we can't modify genetics, but actually we can screen for those. And if you do have a strong family history of cardiovascular disease, don't spare, there are things that we can do about that too to catch it early. And stress reduction, going back to those cortisol levels, and cortisol being a stress hormone, and basically checking our stress. Metformin therapy. A lot of my patients don't like the idea of starting medication if they don't have diabetes. They're like, I want to do dietary and lifestyle modifications on my own, which I do respect. However, a lot of reasons doctors use metformin as a first-line treatment is because you're treating the hallmark of type 2 diabetes. Metformin actually allows the body to be more insulin sensitive, thus helping the insulin resistance, which is the whole cause behind the diabetes and prediabetes too. So Mediterranean diet versus American Heart Association diet, not much of a difference, except the Mediterranean diet is higher in good fats, which now that has been shown that good fats in moderation can contribute to weight loss. And the American Heart Association diet also focuses more on low fat dairy, whereas the Mediterranean diet does not. Both diets have a heavy emphasis, though, on lean meat, more so the Mediterranean, fresh fruits and vegetables. And that is key for preventing and treating diabetes. So I've often had patients say, oh my God, Dr. E, it's going to cost too much. I cannot buy all this organic food. I have a big family, inflation. There are things that you can do. So you don't have to buy everything organic. If your budget allows, you can pull up a list. You can find the PDF online just by simply Googling Dirty Dozen and Clean 15. Your Dirty Dozen are your 12 fruits and vegetables that have a high pesticide burden. And by the way, that's the whole point of eating organic, to make sure that you're not taking in any additional chemicals. The Dirty Dozen are those things that if you can get them organic, you absolutely need to get them organic. Clean 15, if you can't afford to get those fruits and vegetables organic, you don't have to. You're okay getting them conventionally. Meal planning to include batch cooking, using your Instapot or crock pot, and there are different recipe websites that I like to use. Personally, I like the Skinny Taste website. And make it a family affair. I often tell my patients who are wives and mothers, well, I'll be the only one eating healthy in the family. My husband and kids don't want to eat healthy. Why? Why? This is a generational health issue. Make it a family affair. It's okay for you to have your fruits and vegetables and then have a healthy carb for the kids. I always tell my patients, don't burden yourself with making two different meals. It's not worth it. You're gonna burn yourself out and increase your cortisol levels. Soda alternatives for my patients who just have a hard time coming off sodas. There are flavored mineral waters. You can actually, they even have the water bottles now that allow you to use fruits and vegetables, and you can put the infuser in your bottle of water. Unsweetened tea, no, it's not as fun as sweetened tea, but play around with different herbal teas. It doesn't just have to be black, unsweetened Lipton tea. There are other teas out there that actually taste pretty good, especially if they're iced. And you can do kombucha without added sugar. Kombucha is great because it's a natural probiotic. It's fermented. So final thoughts, diabetes does not have to be a death sentence. You do not have to be like your aunt, your grandmother, or whoever that ended up on dialysis or that lost a limb, but it'll take some diligence to prevent and control. And as my grandmother likes to say, to steal her phrase, control your blood sugar, otherwise it will control you. And also, you cannot defeat your genetic makeup, but you can defeat inherited harmful habits. And strive for generational health, as I mentioned before. And shameless plug, here's my book, Diabetes, What Your Doctor Wants You to Know But Can't Tell You in 15 Minutes. That was published not last December, so not December 23, but December 2022, my birth month. I wrote this book because I was inspired by my patients over the years of practice, their questions, their frustrations, and not being able to get all of their answers within the little bit of time that I had with them in the clinic. I wrote the book based on their questions, and now the recommendation is, hey, go read this book, and this is for anybody, not just my patients. Even if you don't have diabetes, even if you have a family history of diabetes, educate yourself. I believe in education, and it has some of everything in there, explaining more in detail type 1 and type 2, prevention, treatment, the different medications, how they respond in the body, how they act in the body to lower blood sugar, as well as side effects. And I threw a few recipes in there for fun. And this is my family. This is our pandemic garden. I need to do something with our raised beds. They're kind of dirty right now. And I love hiking. That is my son and I at Arabia Mountain. We did a New Year's Eve hike. And this is us out walking the woods by Yellow River. Thank you very much. I'm going to close my screen.
Thank you so much, Dr. Echols. I did not know that you wrote a book. I am going to go look it up on Amazon. Thank you so much. So we have some time to open it up to questions. Again, everyone can use the question and answer functionality. It looks like somebody actually just asked, where can they purchase your book?
It's on Amazon.
Okay, perfect. So yeah, folks can use the Q&A. Y'all can use the chat, and then I am gonna slowly go through and allow everyone to unmute themselves if they're interested to ask a question out loud if they would like.
And it looks like Andrea asked, stress eating is a challenge. What tips can you offer to help win the challenge? First of all, being mindful of stress. Oftentimes we're not aware of it, and it manifests in different ways. And stress eating, late night eating is one of those things. As long as you don't have any sort of health issue, actually eating within a certain window of time can limit, I hate to say it like this, mindful versus mindless eating, which is oftentimes stress eating. That can help as well, having a specific eating window.
So somebody put in the Q&A function, please explain more regarding the Dirty Dozen Clean 15.
I said, I wish I knew I was gonna get that question. Because no, I mean, really, because I could actually pull up the list. Let me see if I can actually do that.
Yeah, I was gonna say, if you wanna share your screen with that, that would be great. I've never heard of that before.
There's actually a whole website on it. All right, I am going to try my best to share the screen. I don't know what's gonna come up, but it looks like a pretty comprehensive website. All right, so you can actually see the list here. So these are the fruits and vegetables that when they get sprayed with pesticides, they actually absorb more pesticides. So these are the ones that the dirty dozens are the ones that you absolutely want to get organic and you can feed them. They're dead if you can afford them. There are, I guess you could say, fruit and vegetable washes that you can buy over the counter, which is great for all your fruits and vegetables, but these are the ones ideally you want to get organic if you can. And clean 15, all right, that's 30 dozen. Let me see if I can go backward. They really want my email address. All right, clean 15. So these are the ones that if you can afford to get organic, yay. If you cannot, you can get them conventionally.
Does that mean they have like the least amount, or they absorb pesticides the least?
Hmm.
Okay,
Like for whatever reason, the pesticide burden is great. Why? I have no idea.
that's great to know.
Yeah. So yeah, you can just even do, what that was. So yeah, even if you like do the PDF and you can just slap it on your fridge.
It looks like we got a question in the chat. Somebody had asked, is intermittent fasting a good practice?
It is, of course, you want to ask your physician if you're able to do it. And I did explain that in the book too. And overall, it can be beneficial because you are actually controlling your insulin release. If you're not eating all the time, your body doesn't have a reason to release insulin, and insulin is a growth hormone. You can gain weight if you have too much insulin circulating in your body, which is why if you have prediabetes, you'll find it hard to lose weight. And you're like, oh my God, I can't lose weight. What's wrong with me? So, yes, if you're able to do it, yes, definitely talk to your physician. I know that people with certain thyroid conditions, it's not advisable. You will have to be careful with intermittent fasting if you're actually on an insulin injectable, because, of course, you don't want to have hypoglycemia where your blood sugar drops too low. But just overall, in the broad scheme of things, it's it's pretty good practice if you're able to do it.
So I just dropped in the chat the link for that website, Dr. Echols, that you had pulled up before for the Dirty Dozen Clean 15. Somebody had messaged us and asked if we could reference that again. Um, and with a quick Google search, it was like the first thing that came up. Let's see. And does anyone else have any other questions? And again, you all can unmute yourselves if you'd like, use the chat, use the Q&A. Dr. Echols, I was gonna ask, could you just briefly touch on, does having diabetes type 1 or type 2 put you then at greater risk for other chronic conditions?
Yes, yes, it does. It's not unusual at all to see diabetes along with high blood pressure, high cholesterol. It does put you at higher risk for cardiovascular disease, strokes, heart attacks. So yes. And you mentioned that Zetia would be a good drug. It depends. It doesn't necessarily have the LDL, which is your bad cholesterol. You have good cholesterol, happy cholesterol, which is your HDL. You have your LDL, which is your bad cholesterol. Zetia doesn't have the cholesterol lowering effect that a statin has, but if someone has a bad reaction to a statin, can't tolerate it, or whatever the case may be, then Zetia can be helpful.
All right. Any other questions this morning? I was going to share, Dr. Echols, I know you were mentioning the importance of going in for that routine, you know, routine care,
The
basically.
physical.
Yes. Thank you. Like struggling with words this morning.
Okay.
And correct me if I'm wrong, but did I recently see that you are currently accepting new patients if anyone is
I
looking
am.
for? Okay, awesome. We do just ask if anyone's not speaking, if you could please mute yourself. And so yeah, Dr. Echols, again, you're located at the Emory at Stonecrest location, is that correct?
Yes.
Awesome. So if anyone is looking for a new primary care provider, you've seen one right here today, if y'all are interested. So somebody else just messaged in the chat, please tell me about the CDC lifestyle change programs.
Let's see if I can pull those up right quick. CDC approved diabetes prevention. I'm going to share my screen on that too. Probably should have dropped the link, but All right, there we go. You can go here, you can join a lifestyle change program, find the program, and what you can do, you have options. In-person, online, distance, combination. Looks like DeKalb County Board of Health has one. Emory has a few, and you can just plug in your zip code. We'll just shorten the radius, use my clinic zip code. And then there are a few there. You have the Board of Health coming up. Then looks like there's one in Conyers. I'm not familiar with that one, R&E Healthcare. And that's how you can find out more about them. Also, there is Balm and Gilead, Southeast Diabetes Faith Initiative. And anyone of any faith walk can participate. Of course, it's more Christian-based, but they don't discriminate against anyone.
That's awesome. These are great resources to have as well. It looks like somebody had also asked in the chat, and I'm not sure if I'm assuming they were referring to Zetia. They had asked, what is the alternative drug?
So, of course, research is very slim on this. Some people take red yeast rice, but of course, because trials are so small on herbal remedies, and herbal remedies are not standardized. So for instance, you can get 2 different brands of red yeast rice, both at, I'm just going to throw a random number out there, both at 50 milligrams each, One may have the proper amount of red yeast rice for cholesterol lowering effect, and the other one may not. So that's why I don't typically recommend those. If a patient wants to try it, then I'll let them know the side effect profile of it and everything, which honestly is very similar to a statin. They're like, oh, well, I've heard statins increase your liver enzymes. I'm going to take this red yeast rice. Thank you for letting me know, because red yeast rice can do the same thing too. Because it is based off of, lovastatin is based off of red yeast rice. So diet and exercise, stadia, statins, um, omega-3s may have some benefit with increasing your HDL, which is your good cholesterol, but not necessarily lowering your LDL. So just be aware of that. And it can also lower your triglycerides to 1
So it looks like we had a few more questions come in the chat. Somebody asked, does blending fruit for a smoothie cause your body to process the natural sugar differently?
It sure does, because your body actually chewing and the enzymes in the saliva actually work to break down sugar, and it works to break down fiber. So eating the whole fruit is always better. And also keep in mind, when you do a smoothie, if you look at the amount of fruit that you put in a smoothie, ain't no way you're going to sit down and eat cups and cups of fruit just in one sitting. But you're blending cups and cups of fruit to create a 16 to 20 ounce smoothie. So you need to be very careful with that. Like your smoothie really should be your fruit intake for the entire day, or maybe even the entire 2 days, depending on how much fruit you put in there.
Do you have other recommendations for things to put in or not put in smoothies, if that's like a preference for folks?
Add green veggies. Are they fun? No, they're not as fun as the sugar-filled fruity smoothie. But if you don't necessarily like the woody taste, I guess you could say, of vegetables, spinach is always a good one. Spinach is super mild. If blended well, you can barely taste it. It'll be incredible green, because the spinach in there, but it won't have that harsh woody taste. I'm a foodie, in case y'all can't tell. It won't have that harsh wooden taste that blending kale would have.
Great to know. Let's see. So a few folks have been asking if this recording presentation will be shared afterwards. Yes, and we will share at the end how that will be done. Looks like somebody asked some herbal teas such as clove tea, cinnamon tea, bitter, mellow, fenugreek are good to lower blood sugar.
Especially cinnamon and fenugreek. And a lot of, if you look over the counter, at the over-the-counter supplements, a lot of them actually have that combination in them. And keep in mind that once you reach that diabetes threshold, you're going to probably need a little bit more to lower your blood sugar. Those are good supplements. For instance, I have patients who are like, well, I don't want to be on too much medicine. Well, what if I just take this one pill a day? Again, it's trial and error. It's not necessarily standardized. But yes, I have seen it help lower blood sugar. And actually, once upon a time, I talked to several of my colleagues in the functional medicine world. No, I'm not the doctor who's like, oh, take this pill. All my patients know I give it medicine. I really, really do. And if we can't avoid it and do lifestyle, then I'm all for it. Sometimes there is a time when we need drugs. There really is. But I talked to a colleague in functional medicine, and they were actually saying, because they have more knowledge than I do about these herbal supplements and the actual medicinal doses required to help manage some of these chronic medical conditions. And once they told me the actual doses, there was a supplement on the shelf that had very similar dosing to what they mentioned. I'm like, you know what? For my patients with prediabetes, they may want to consider that. Apparently, the supplement company may have caught on, because then they actually started reducing the amount of herb in that supplement, so it wasn't as potent anymore. That was interesting.
Oh, man. Somebody had mentioned in the chat, I do have, I'm assuming potentially stands for Diabetes Management Program here at the school, and that's going well. So that's great to hear. Another person asked, what is your input on the Ozempic shot every day?
Ozempic shouldn't be dosed daily. Ozempic is weekly. It's, I guess you could say, its oral cousin, Rybelsus, which is a pill, is semaglutide. So Ozempic is semaglutide, and Rybelsus is semaglutide. Rybelsus is a pill that's every day, but the Ozempic shot should only be once a week. And if I'm not mistaken, Victoza is also Ozempic's cousin, but that's a daily shot. And just in general, it's not that we don't prescribe Victoza anymore, but we don't prescribe Victoza the way we used to now because we have so many patients who are not insulin requiring diabetics who just cannot fathom the idea of a shot every single day, even though they're not on insulin. So cue the GLP-1 agonists that are once a week.
Awesome. Thank you for sharing that. Any other questions, comments, feedback? Got a few more things in the chat. Somebody had said, please, what was the other tea after cinnamon tea?
Bitter melon. Bitter
Yes.
melon.
All right. Well, if not, we will wrap up. Is it bitter mellow or bitter melon? Melon? The tea?
Should be bitter melon. I've heard of bitter melon. I haven't heard of bitter mellow. So
Okay.
that may be something different.
Yes, it's melon.
Okay, bitter melon.
There we
Okay.
go. We still got a few more things. Yes, to everyone asking if this will be shared, we will share the recording as well as the presentation. Few more things coming in the chat. This is great. Y'all have been super interactive this morning, which is always so helpful. We did get another question. How does exercise lower your blood sugar?
Because when you exercise, your cells get hungry, and that extra blood sugar that is circulating in your bloodstream, the exercise actually helps those insulin receptors work a little bit better because it's like, oh my God, my cells are starving. Okay, it needs energy. We're going to use this sugar that's just kind of floating around out there. So that's how it helps to lower it.
Wonderful. Well, questions keep coming through, y'all. This is great. Somebody asked, what are your thoughts regarding daily insulin shot? And once taking insulin daily, is it possible to reduce that from daily to weekly?
So insulin is never dosed weekly. Never. Insulin is given based on the body's need for it. Remember, insulin is a natural hormone in the body. And just when it starts acting a little bit wonky, then we have this condition called diabetes. Essentially, it's what it is. So the way insulin responds naturally in someone who's not diabetic, you eat, no matter what it is, your insulin level goes up and it comes back down. Eat again, it goes up and it comes back down. But insulin never sleeps. That's your basal, that's your floor. So that's how people can sometimes wind up on 4 insulin injections a day. They're missing their floor, their basal that allows them to remain steady. And then when they eat, if they don't take an injection, their sugar goes up and it stays up. That floor is not enough to bring it back down. So that's how that works. So insulin injections are never once a week. You need insulin every day. Insulin is important for metabolism, essentially. And to the question of if you can get off, it depends on how much damage over time your beta cells in your pancreas have gone through. If the beta cells, if you've had diabetes for a long time and your A1C is constantly out of control, your blood sugars are constantly high, those beta cells have to work harder, and after a while, like, we're tired. We give up. We're not going to create any more insulin. You're going to have to inject this insulin. And there's no way to really test, unfortunately, to see where your beta cells are. So it depends on how quickly you can get your blood sugar well controlled, because I've seen this. Patients who are first diagnosed with diabetes, their A1C is like 13, 15. They're like, oh no, this is not going to happen to me. This is not, I saw what this did to my family members. This is not going to happen to me. They're aggressive. There's not much damage to their beta cells. So as a result, with diet and exercise, they can come off insulin.
We just got another question. Oh, we got a few more. Somebody said, what do you think about, I'm not sure if this was a typo, Rise
Coffee, the mushroom coffee. So again, it's sort of hard to tell with Rise. It's sort of hard to tell with any herbs if they haven't necessarily been tested. And also too, it always depends on to what degree does it lower your blood sugar. If your blood sugar is 400, chances are you're going to need a little bit more of the Rise coffee to lower your blood sugar. Whereas, say for instance, your fasting blood sugar is 120, 110, which is still considered elevated because of normal fasting blood sugar is 70 to 90. Then yes, maybe it can. I just know it's a mushroom coffee, and it's different mushrooms like lion's mane and a few others in there that have been known to support good blood sugar metabolism.
Someone else had just also asked, what is your opinion on brown sugar or honey for tea, or just non-sweet tea is overall best?
I'm glad you asked about brown sugar. You know what brown sugar is? Sugar with molasses added to make it brown, to make it have a more robust flavor. That's all it is. It's still sugar. Honey can actually still cause a spike, blood sugar spike, but not as much as just raw cane sugar. But yes, it can still spike your blood sugar. If there's a difference between using a teaspoon of honey, and I tell my patients, measure your stuff. If you measure your stuff, you're gonna come out, your feelings gonna be hurt. You're gonna realize you're putting more than just a teaspoon of honey in that coffee or that tea. So that being said, if you put just a little teaspoon of honey in there and you measure the teaspoon, your feelings are gonna be hurt. But 1 cup of tea a day with a teaspoon of honey is not going to hurt.
We also just, somebody said, last time they checked their A1C was 6.5. What can they do to lower it within the next 3 months before they get it rechecked?
So lifestyle changes, monitoring your carb intake, exercise, and then of course diet, which is all part of monitoring the carb intake. And you also mentioned, what about creamer in your coffee instead of sugar? If you're talking about sweetened creamer, same thing. I mean, it's sugar. It's creamer. It's milk based with sugar in it. And another thing about dairy too, I am not vegan. I like food. I like dairy. But one thing that I've noticed, just because if a patient has a good suggestion about something, then I'll actually try it for myself. I tried this diet called the E2M diet, E number 2, letter M, eager to motivate. It's on Facebook. And she talked about how drastically her A1C came down in 3 months. So the person who asked me that too, that's something else to consider as well. And essentially the diet was a reduced carb, anti-inflammatory diet, full of, and it was carb cycling also, with lean meat and vegetables primarily. Very sustainable, very workable. Yeah, so that's something else to consider in terms of lowering the A1C. But the whole point of it was the no dairy part. That I declare is what helped me lose weight, because some dairy can be inflammatory. So just being careful with the dairy intake. And you mentioned sugar-free creamer as well.
I need a bit today.
If you absolutely need to have your creamer, okay, fine. But one thing to keep in mind about sugar substitutes as well, the verdict is still out, but there has been some research to show that the body sees sugar substitutes as sugar So you just may want to keep that in mind. You won't get the sugar spike, but the body will be like, wait a minute, is this sugar or is this not sugar? So again, verdict is still out, but something to be mindful.
Looks
And
like,
someone mentioned rosemary with cinnamon tea.
yep.
Yes, rosemary is great. You have to be careful with rosemary if you have high blood pressure.
Someone also asked about, is it safe to use Splenda stevia on a daily basis?
I would go with stevia because stevia is natural. Splenda is more processed. And the thing is, you want to get stevia as close to the natural source as possible. Stevia is often bleached to make it look whiter and pretty and more palatable and more like sugar. It's a marketing thing. This may be a bit of a burden, but this is better. Grow your own. Get a stevia plant and grow your own. I don't know if you have an air fryer at home or not, but my air fryer actually works as a dehydrator as well. You can dehydrate your stevia, put it in a coffee bean grinder, and grind it up into a powder.
Good morning. Good morning.
So, food for thought there if you have a green thumb. The diet on Facebook, E2M. If I can do that.
And then what was the statement again about rosemary and high blood pressure?
You have to be careful with rosemary and high blood pressure. It's one of those things where it's like, okay, if you're just putting rosemary in food on culinary, we call it culinary levels is fine. But if you're using rosemary as a therapeutic treatment, you need to be careful with that. There are even certain hair products that basically increases the blood flow. Certain products have rosemary in it. And, of course, women, we want to protect our hairline. There's a little bit of vanity thing. We're losing our hair. And you have to be careful with actually using rosemary-based oils around your hairline. I've actually seen that in my patients. They're like, all of a sudden my blood pressure went up and I just have no idea why. And we just started talking, having a little conversation. They're like, yeah, this hair loss, I started using this new product. What new product? It had some rosemary, it had some, I'm like, all right, that's what it was.
Oh, wow. Somebody else just said, sometimes I crave soda, but I use half soda and half water so I can get that soda taste at least once a week. If this is not better than drinking the whole soda, what can I substitute when I crave sugar?
Once a week, that's it. Let that be your treat. If it's just one soda once a week, let it be a treat.
Is it true, and I could be making this up, but is it true that when when you feel like you're craving something sweet or sugar, is it true that normally means you're thirsty or dehydrated and you need water?
Yes.
Okay. I feel like I learned something somewhere once when it was like, when you're craving X, it means you actually need Y. And so there was lots of cool examples. And I remember when it was like, you want something sweet, just drink water. You're probably dehydrated. All right. Well, thank you everyone so much for being so interactive and asking all these great, amazing questions and examples. Somebody just said we're dropping knowledge bombs all over the place, which I love that. And so we are going to wrap it up here. And then if y'all just want to stay on for 1 second, I'm going to share some information afterwards on how you all can access this information. So just wanted to say thank you so much, Dr. Echols. We greatly appreciate you being such an amazing resource for everyone this morning and sharing all this amazing information. And we have some details to share on our next upcoming talks. So thank you all for joining this morning.